I'd like to begin the symposium by saying a few things that I learned. In the 8 years that I was the executive director of West Bay, I attended all the symposium and all the health-related seminars at UC, and I have never attended one that was focused on the Filipino community. It's always been about the Chinese, the Laotian, Cambodians, the Japanese, and the Vietnamese, but never a Filipino. And that was, to me, was something that's striking because we are the second largest minority in the United States. And why is that happening? So when Dr. Francisco C., who heads the NIH and who was giving $200 million in grants for academic research and medical research, I had an opportunity to have lunch with him. And I asked him, what's going on with our community? Because everything that I hear about our health condition is anecdotal. There is no scientific research that I could find. And you know what Dr. Z told me? He said, Rudy, every year I give out $200 million in grants, and I have never given one single dollar to a Filipino. And I asked, why is that, Dr. C? And for as much as he can tell me, he said that because when Filipinos finish their academic school and they graduate, they always go for the highest paying job. They don't go into research because there's no money in research. And that to me is very sad because, as you will learn today, we have the highest incidence of hypertension, diabetes, all known malady. We have the highest. We even have the highest, more than the Latinos and the blacks, which I thought were the highest. So we're going to scale this thing up. The next one will be in Los Angeles, and the next one will be in San Diego. And then after that, we're going to New York and Washington, because I'm a part of a national organization with 13 regions across the United States. And they're all ready for us to scale this thing up. We need to start a national conversation. We need to raise the awareness so that we can go ahead and have some sort of intervention and some lifestyle changes. So our kids will not have a shorter lifestyle span than we do. There was a study that came out. For the first time in American history, our kids are going to have a shorter lifespan than their parents. And since we are in the forefront of every known malady there is in the all ethnic groups, it makes sense for us to immediately start the conversation, talk among each other, find out what we can do so we can help reverse the process. And with that, I'd like to invite our Consul General to be. Jaime Escalon is our Deputy Consul General. Unfortunately, the Consul General is in Malaysia and he can't be here today. But Jaime, if you would please put your hands together and help me welcome Jaime Escalon.
Magandang hapon sa inyong lahat. Good afternoon. Welcome to the Philippine Center. So you're in Philippine territory. To the social hall, which also serves as our folk life museum. Thank you so much, Rudy, Mr. Rudy Asurcion, for partnering with us, with the Philippine Consulate, in this first National Health Symposium for the Filipinos. I think we are really privileged to be hosting the first of the many of symposiums on specifically on the health of Filipinos, because as we know, and the cliche goes, health is wealth. But we are also very happy because this is in accordance with the thrust of the Philippine Consulate, which is empowerment, connectivity, and continuity. So here we see that we are all empowered because we gathered, and I'm so happy when Rudy presented the proposal. I'm so happy to know that we have a lot of experts here, our distinguished panel members from the Filipino American community, who will be sharing their expertise and their knowledge on this issue. So I think this is just the beginning, and on a personal note, I know how difficult it is, especially for the kids. When we arrived here 2 years ago, I had my second son was very cute, but he's very chubby. So we made a deal that by October, he had to lose, I think, 10 pounds, but his weight should be below 100. And the price, of course, there was a bribe, a PlayStation, but it's okay. So I saw him work hard. His brother is fit, so he had to run. He exercised and he lost weight, and now he's really fit. The problem was the dad now gained weight, and he's the one now telling Dad, don't eat that. Dad, you're so big. So I think Rudy's right. The younger generation, you'll have a role, and to remind also the older generation that we have to be fit. Again, welcome to the consulate. This is, as I said, this is a start of a good partnership, and let's all be engaged because this is a very, very important topic. Magandang hapon, and wish you all the best for today's symposium. Thank you.
Okay, thank you. I'd like to introduce myself. I am Amy Fable. I am an assistant professor at the State University of New York Downstate School of Public Health. I'm from Brooklyn, and so you're probably wondering, what am I doing here? 4 years ago, I was a researcher at UCSF. I lived in San Francisco for 10 years, and while I was doing research at UCSF, part of my work, all of my work focused on immigrants. Part of my work focused on chronic disease, and then even a smaller portion of my work in the Filipino community began at UCSF, and that's when I had the grand opportunity to meet Rudy Asercion and his wife Esther Ore, who were at the time directors of West Bay. I partnered with them to conduct a community-based participatory research project. And the goal of that project was to understand and find out what the meaning of health is in the Filipino community. So we talked to the families of West Bay and Soma, and from there we began formalizing and our thinking around health in the Filipino community, in particular chronic disease. We're obviously, I'm a scientist. I feel like I have a job. It's my role to bring the data to the community. When I began, we didn't have a lot of data on Filipinos. When I got my PhD in 2003. I know I'm dating myself a little bit, but when I began, we had very little data on Filipinos. But I have to tell you, we made a lot of progress, and a lot of that progress began here in California because of the majority of the Filipino population lives here in California. So I'm going to talk about some of that data today, and I'm hoping that data will really encourage you, mobilize you into doing something in the community to, as Rudy was saying, reverse what we're seeing. And so anyway, okay, so I'm gonna give an overview presentation. I'm not going to go into too much detail. I don't want to bombard you with too many facts, too many ideas, but I'm going to talk about really some of the major statistics, data that's out there, and also concepts. And I'm hoping our panelists will cover everything in much more detail. And so I just wanted to comment, my title slide is The State of Filipino Health, the title of my talk. And I don't know if anyone of you recognize that. Does anyone know that mural here? Mm-hmm. Where is it? Well, it's in National Filipino Health Equity Symposium. Okay, great. So can we? Okay, so in some of the marketing materials for this symposium, you saw this alarming statistic, right? So over 7 out of 10 Filipinos adults are overweight or obese in California. Okay, and so can you flash me a hand sign or something? Oh, is this good? Yeah. Okay, so this represents so we're doing so that comes from evidence from California, actually population-based data of over 45,000 adults. Okay, so this is a statewide survey that was given to people throughout California. They found that 7 out of 10 Filipinos are overweight or obese, and that was the highest in comparison to all other racial ethnic groups. We had the highest rates of overweight obesity. Why is that the case? Okay, so overweight and obesity is defined by body mass index. Okay, so I know when we think about overweight, we think of obesity, we just think about how many pounds we weigh, right? But when we actually, in medical terms, the scientific way of actually defining BMI, overweight and obesity is through body mass index. And that's basically the ratio of your weight to your height. And something you might not know is that we define overweight and obesity differently for Asians versus the general population. And so you see that for overweight obesity, we have much lower thresholds compared to the general population. Okay, and so they're right here. And this may not seem, again, you guys are more familiar probably with pounds. And so on the next slide, I'll give you an example of how we actually convert our weight and our height into BMI. Okay, so as an example, okay, I'll take myself an example. Here on the, actually we don't see the whole, can you bring that slide down? No. Anyway, well this is, sorry, there's technical difficulty.
It used to be the full thing.
Yeah. Is that the slide? Yes. Okay, well basically, you can't see it here, but what the first column indicates is your height in inches. And so I'm 5'3", so I would be up on top at 63. And then you have to the right the number of pounds you have. And so if I was, let's say if I was 66 inches and 136 pounds, that first column actually indicates normal weight. And then as you go to the right, you get into overweight and obesity. Okay, so you need to take into consideration your height, your weight, and your weight, and that will tell you what your BMI is, and that BMI value will determine whether you are overweight or obese. I'm sorry that slide didn't show up, but I had an entire table there. Okay, so overweight and obesity puts us at risk for several chronic conditions. And again, I'm not going to talk about this in detail. We'll have Dr. Gabiola from Stanford talk a little bit more about clustering of risk factors. But basically, in medical terms, this is called clustering of risk factors is called metabolic syndrome. Metabolic syndrome is defined as having 3 or more of the following conditions. You could have elevated fasting glucose, elevated blood pressure, reduced good fats, so high density lipoproteins, elevated bad fats, so elevated triglycerides, and elevated waist circumference. So if you have 3 or more of these following conditions, you're at a greater risk of metabolic syndrome. Okay, and so I mentioned metabolic syndrome because, as Asians, we are at an increased risk of metabolic syndrome in comparison to the general population. Again, so across all BMI values, we have a higher risk for metabolic syndrome. And so you see here, so if we had if we were comparing 2 women, and one woman was Asian, one woman is white, who are the same age, and at the same BMI, the Asian woman will have a higher risk of developing metabolic syndrome compared to a white woman. Okay, so this is actually the predicted prevalence of metabolic syndrome among Asian women who is 55 years of age at a BMI of 25. She has a 30% chance of developing metabolic syndrome compared to a white woman of the same age and the same BMI. She only has a 12% chance. Okay, so what does that mean? That means that our weight gain has a much more severe consequence with regard to metabolic conditions and health risks in comparison to the general population, in particular the white population. Okay, and so I want to also acknowledge one of the first studies on diabetes in the United States. It's the first epidemiologic studies on diabetes by Lucely Quasi, who actually was going to be a presenter today, but unfortunately she had to go to the Philippines because she's caring for her brother's her brother's wife, who is actually suffering from type 2 diabetes and kidney failure. So ironically and sadly, she can't be here with us. But I wanted to acknowledge that she was actually one of the first epidemiologists to put out a study on diabetes, and her study was conducted back in 2001 in Houston, Texas. Okay, but basically what she found was that in 2001, okay, we're in 2015 now, she found an overall prevalence of diabetes in the Filipino community in her population of 16.1%. Okay, and so if you put that in perspective, today in 2015, the national prevalence rate in the United States is not even 10%, and that's back in 2001. Okay, and so she found that's an alarm, that's a very high rate of diabetes, and you see here the graph suggests that the prevalence is even higher based on these risk factors. So if you're obese, you have a much higher rate. You have almost a 30% prevalence. If you are a woman and had gestational diabetes, you had over 55, your prevalence was over 55%. Males, if you have a family history, you have a higher risk. If you're male, and obviously if you're older, you had a higher prevalence of diabetes. Okay, so we know that diabetes is a disease of the aging, so that makes sense that it's much higher in the higher age groups. Okay, so fast forward in 2015, we have the benefit of Kaiser Permanente, who has published several studies on chronic disease in the Filipino community, but also in its diverse population in general. We're going to have Dr. Zico talk a little bit about more about Kaiser afterwards. But they're one of the first to come out with this really large study because of their patient population base. So so back in I think this was 2012, they came out. Researchers at UCSF came out with a study of over 2 million patients of Kaiser patients, and this was sort of a report that came out of Kaiser from that study, which showed that Pacific Islanders, South Asians, and Filipinos actually had the higher rates of diabetes compared to all other ethnic groups. So this is what Rudy was referring to earlier. Filipinos have higher rates of diabetes, even in comparison to Latinos and African Americans, who are traditionally known to be at highest risk. Okay, and so here we see the rates, the actual rates. This was a study conducted in 2013. We see that Filipinos have the second highest rates of diabetes in comparison to other groups. The Pacific Islanders had the highest rates, but we're sort of on par with South Asians as well. But you see here we have much higher rates than Blacks, Latinos, and all these other ethnic groups. I don't show all the groups here. I just want to give you a sense of how much our rate differs from the other ethnic populations. Okay, another point I wanted to communicate to you, and another question I want to ask you is, again, thinking about why we have such an extreme, severe burden of chronic disease in the community. a question, that I like to ask in my own research is, is there something about living in the U.S. that makes us unhealthy? Okay, and so I asked that question in my research, and I thanks to data that was conducted by the from a center at NYU. We just submitted for publication a paper on living in the U.S. and obesity among Filipino immigrants that live in New York City. Radora Ursula is also an author of this study. She's a panelist as well. And we found that, so what we looked at is whether the prevalence and the risk of overweight and obesity varies according to the number of years you live here. So how many of you are immigrants, are born in the Philippines? Okay, so that's almost the majority. And so basically, those that have been living here 10 years or more have a much accelerated development of diabetes, or have a much higher risk of diabetes compared to those that recently came here. Okay, so we see here that if you have lived here 10 to 15 years, or let's look at the top bar, those that have been living here 15 years or more, their prevalence of obesity and overweight was over about 27%, and you compare them to those that have been living here under 5 years, and that's about 18%. And so there's something about living here that is contributing to this weight gain, and this rapid development over overweight and obesity. I have my own hypotheses as a researcher, as someone living here. I know, as you obviously probably have your own ideas about what might be contributing to it, but I think it's pretty clear that the environment here contributes to what's going on as well. And Radora Ursula, one of our panelists, is going to talk a little bit about how environment might impact our chronic disease risk. Because it's not all about what we do and what we eat. Obviously, what we do and what we eat, whether we exercise or not, that's a central and proximate factor in determining our disease. But that's determined by the environment that we live in. And there's something unique about living here that contributes to our disease, and that's not only present in the Filipino community. I've done this study in Chinese immigrants. We see it in Latino immigrants. There's something about living here that contributes to this increased risk. And again, the slides. And I wanted to show you that obesity, basically, the U.S. has the highest rate of obesity compared to all of the, if you compare them to the similar income countries, all of the higher income countries, we have the highest rates of obesity, and for some reason that's not showing up here. But yeah, so there's something about the U.S. U.S. is unhealthy to begin with. We're ranked 34 in life expectancy. So we spend a lot on healthcare. We spend trillions of dollars in healthcare. What we spend in healthcare is not translated into good health. And again, the environment in the U.S. for some reason is making us sicker. Okay, another thing we'll talk in more detail about later on. Our nutritionist and personal trainer will talk about this. Is this concept of weight gain? It's simple, right? You gain weight when energy consumed is greater than energy expended. Okay, keep going. So, so we need to do more to, if we enjoy our food, if we like to eat, that's okay. Food is central to to our Filipino culture. It's central to a lot of cultures, so what can we do to balance that? Or are there tips, are things that we can do in moderation to sort of begin balancing our energy? Okay, and again, I want to emphasize that we want to try to balance. We're trying to encourage everybody to seek a more balanced lifestyle, balance our lives. What I just presented here is that we have all these factors that are making us unhealthy. So, if you see on the right, we have a group vulnerability, right? So as Filipinos, we're at an increased risk of chronic disease. Uh, so on top of that, we live in an environment that makes us sicker, okay? On top of that, we also like to eat, and not a lot of us are very physically active. How do we balance those factors and sort of reverse those and challenge those factors so that we tip the scale to a more healthier lifestyle? And obviously we engage in a more healthier lifestyle if we eat healthier, if we engage in physical activity, and if we manage the conditions that we already are suffering from in an effective way. And so we're going to talk in more detail about these, with the other panelists are going to talk in more detail about these different aspects of balancing our lives. And Dr. Charito Sico will be talking about managing conditions. I'm sorry, there's this typo there. It's Charito Sico. She'll be talking about managing conditions from the standpoint of Kaiser Permanente, where she practices. Joanna Snyder, who is a registered dietitian, will talk about how we can eat a healthier and more nutritious diet, as well as engage in physical activity. As individuals, how can we begin living, following a lifestyle that will prevent these diseases? Dr. Melinda Bender from UCSF will be talking about population approaches and evidence-based approaches that can help Filipino populations prevent diabetes and manage diabetes as well. And then Dr. Gabiola will be talking a little bit more about sort of clustering of risk factors among Filipinos. And finally, Redora Ursula will be talking about community engaged approaches, as well as how we can begin modifying and understanding how the U.S. environment contributes to our chronic disease burden, as well as how we can begin mobilizing and advocating for policies that address the physical environment that we live in. Okay, so that's it. So if there, and you know, so this is a symposium. If anyone has any, we want, as speakers, we don't want to engage the audience. If anyone has questions at any time point during our presentations, feel free to raise your hand, or you can wait till after each of us presents. So again, if you have a burning question, feel free to raise your hand. Otherwise, we'll move on to the next presentation. Okay, can we go to the next one? That's Dr. Sico.
Yes, find it.
Yeah.
Oh, sorry.
Okay, so our next presenter is Charito Sico. She's a physician, medical director of the Center of Excellence in Culturally Competent Care for Filipino Health, and she was the recipient of the 2010 R.J. Erickson Award from Kaiser Permanente's National Diversity and Inclusion Office for her leadership in designing the Filipino American Care Experience Program, FACE, which demonstrates exemplary efforts to advance Kaiser Permanente's diversity and inclusion agenda. Please welcome Dr. Sico. You have a question?
I wanted to ask, a lot of these things that you're talking about are external things, environment and all that. You in the symposium going to consider the internal state of affairs that our beliefs are, you know, the habits that we've, our DNA, so to speak. Will you cover that?
Yeah, Dr. Sico will cover that a little bit. You mean our genetic predisposition for it?
Genetic and the psychological, the emotional condition of things, our state of being, you know, that kind of thing.
We're not going to go into this too much of the psychological aspects of it, but we're going to. Oh, Dr. Gabiola.
No, Dr. Gaviola covers cultural aspects and beliefs.
Okay, so Dr. Sico will talk about the cultural beliefs and some of our genetic predispositions.
You talked about whether living in the U.S. is causing one of the issues. Have you compared that to the people who are living in the Philippines, how healthy they are?
Unfortunately, no, but I'd like to. Actually, we submitted a proposal to do that, to get funding, and it wasn't awarded. But I'm very interested in understanding. Excuse me?
That's not fair.
And Dr. Gabiola will talk about that as well, but that's an important point. Anything else? Okay, so, well, please welcome Dr. Sico.